Good afternoon, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping good health. Today, we are going to discuss about our skin health with focus on urticaria or hives, which we or our near and dear ones would encounter at some time in their lives. Urticaria is characterized by round rash on the skin that itch intensely. It may be due to chemicals in certain food, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, venereology, and leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidents are higher in older group. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us a renowned dermatologist of India, Dr. Jatin Sidhwa. He's an MBBS, MD dermatology, dermatologist, cosmetologist, dermatosurgeon, and he has an experience of 9 years and 2 years as a specialist in this field. And his skills and compassion has made a tremendous difference in patients' life. He's currently practicing at Sidhwa Skin Clinic. A very warm welcome to Dr. Jatin Sidhwa. It's a pleasure, doctor, to have you with us today. And we are going to discuss about a very important topic today, which is the management of urticaria. First of all, I would like to ask you, what is urticaria?
So basically, urticaria, it means that there's a recurrent formation of something called wheals in our skin. So what do you understand by the term wheals? Wheals is a well demarcated erythematous plaque that is formed onto your skin in response to an allergen that is coming from outside. Now, this allergen can be acute in nature, happening in the last 2 to 3 hours, or it can also be chronic in nature, occurring over a week. So, in response to this reaction, there will be a well demarcated, and the most important point is a transient swelling. It will keep coming, going, and then after a few hours, it might reoccur as well. And depending on whether we take treatment or we don't take treatment, it can increase. It can involve other areas of the body, and then it can go something into what is called angioedema. So basically, what we need to differentiate is the type of urticaria that we are having, and along with that, the initial cause or the aggravating factor against which the body is reacting to it by forming this wheal.
Right. Right. Well, doctor, you have already mentioned about the cause of urticaria. So, what can be the causes of urticaria?
So there are a lot of causes. Sometimes it's even idiopathic. So we need to divide urticaria into the type of reaction that is happening, whether it is acute in nature, whether it is chronic in nature. Now, depending on that, firstly, we'll discuss about the acute causes that can be there. In acute causes, the most common ones can either be a food or a drug kind of an allergy. So when it comes to food, which is most commonly that we see the urticaria outside, other than the normal drugs and any kind of an infection that a person has, when we come and talk about food in general, we have to ask about history of what all food he was consuming in the last 1 or 2 days. Most commonly, the ones that we see in our practice are after a person has had any food from outside. So when it comes to non-vegetarian food, for example, your seafood, prawns, all these can, if it's not very fresh, it can induce an allergic reaction. Recurrent wheals can be formed because of that. Now, other than your seafood, something that contains related to dairy products, even that can cause urticaria. Other than that, any kind of a preservatives, food coloring agents that we use into our food. And there are different kind of, for example, people will be having different juices, wines, or any other kind of stuff which is being stored and it contains preservatives. The store bought food that you usually have, those ready to cook kind of a stuff that you can make in 2 minutes. Again, all different kind of preservatives can be there. Now, other than that, when we talk about rare causes of food that is there, then we can think about even dry fruits. If there is some manufacturing error, something like that, for example, your almonds, your peanuts, anything like that can also induce an urticarial reaction in the person. So this is broadly talking about food in general. Now, other than food, what can cause acute urticaria is consumption of any kind of a drug. Something as simple as a beta-lactam antibiotic that we usually take augmentin for fever or something like that. So that can again induce a reaction. You have to keep that in mind. And most commonly that we see other than this are any kind of a respiratory infection that a person has. Your immunity, as soon as it goes down, that can again lead to this antibody reaction, resulting into your wheals. So any kind of an upper respiratory tract infection, it can be bacterial, it can even be a viral infection. These can be the ones that can usually cause your urticarial reactions to happen in an acute nature. Other than that, there are different causes. They can be something called a cholinergic urticaria. So cholinergic urticaria is when there's a difference in temperature. You work out, there is sweating. After that, it can be formed. If there is any kind of a worm infestation into your body, again, it comes to your dietary habits only. So we need to test for that also. Then there are different kind of contact allergies after which urticaria can happen. You can come at any contact with any allergic kind of a fabric, any jewelry item after which these things can happen. You can also go out into the sunlight after which the ultraviolet light can cause these urticarial reaction. Spending a lot of time in water, this can cause aquagenic urticaria. So in broad terms, there are a lot of different kind of causes, and sometimes the unfortunate part is there's something called idiopathic urticaria where we are not able to find any specific cause for the urticaria as well.
Right, right. So, doctor, now the main question arises here is how does it look like? How does one differentiate between urticaria or any other skin diseases? How does one know that this is urticaria and now it's time to go visit the expert?
Exactly. So, as I said, the transient nature is something which is the differentiating point over here. You might feel different kind of itching. There might be a psychological itch that you might be having. There can be an itch due to an insect bite that can be happening. But when it comes to an
Mm,
urticarial itch, that is characterized by formation of something called wheals. So wheals basically is a transient swelling. It will come, it will start to become pruritic. What we mean by pruritic, it means it becomes itchy. And the more you start to itch, you can see different kind of these urticarial wheals coming to different parts of your body. And then it will go down, it will subside in a few hours, and then again it can be recurrent. It can reoccur twice or three times in a day. It can recur once or twice in a week. And depending on that, the treatment aspect of it differs. And when it comes to the wheals that is formed, that is just the initial part of the urticaria. If it's not controlled, sometimes it can go into something called angioedema. So angioedema will not be itchy. Here, the swelling will be more painful in nature, and along with painful, it will be tender. There might be swelling of lips in a very severe reaction called anaphylactic shock. You might even have difficulty in breathing. So knowing what kind of symptoms are there and then taking treatment for it at the right time can prevent it at the very early stages.
right, right. Doctor, now that we know the cause behind it, we also know that at times the cause is unknown, but we slightly have an idea about what is urticaria by now. Uh, so let us know, please, is urticaria serious for the people who are taking it very lightly? They see a slight change on their skin and then they are like, "अरे, ठीक हो जाएगा थोड़ी देर बाद." So for them, if it's urticaria, is it serious?
See, it depends on the frequency of which it is happening. So, as I said, there's a difference between acute and chronic urticaria. So, what is the difference between the
Hmm.
two? If it's an acute urticaria, it's happening within 6 weeks. After 6 weeks, it resolves itself. The body by itself will try to counter this allergy that is happening. When it comes to
Hmm.
chronic urticaria, it's more than 6 weeks. So, if you feel your symptoms are occurring more than a month, then definitely you have to think about it why this is happening. You need to know what is the cause behind it. If you're able to easily find a cause, you can consult a dermatologist. He can start you on any kind of an antihistamine, and this will be okay. But when do we need to worry about it? So the point where you have to worry is if there is any kind of a angioedema. So again, what I mean by angioedema is instead of the rash, which is more itchy, it will start to become more tender, and along with tender it might be a little bit painful also. It's a deep kind of a swelling, so it will affect your areas like the swelling of your lips. That is something which is most commonly seen as the body going into vasculitis. So that is again something where we need urgent treatment to be taken. Along with that, as I said, anaphylactic shock if you're going into, so that means there'll be difficulty in breathing. If you reached up till that stage, then you have to definitely go to a hospital as soon as possible, not wait a long time. But even in general, let's say we are talking about this acute urticaria, as you talked about, where the symptoms or the wheals are coming once or twice in a day, maybe just once or twice in a week also, but they subside without any cause. But still, you need to know what is the reason behind it, why it's happening. Sometimes something as simple as getting a dental cavity removed, after that these kind of an infections might come. Sometimes, as I said, there's an upper respiratory tract infection. So because of this, again, the person will not be knowing what is the cause that is happening, and then the recurrent reason at this wheeling that is happening does definitely have a psychological impact on the person's life as well. So definitely, if you feel that the symptoms are happening more than 2 weeks, 3 weeks, you should definitely go and consult a dermatologist.
Right. Also, doctor, let us know if this is contagious. Is urticaria contagious?
No, urticaria by itself is not contagious. It's not.
Hmm.
It's an allergic reaction. So basically, what it means is there is something. There's an antibody in our body called IgE antibody. So this
Okay.
IgE antibody, whenever this allergen is there, there'll be an antigen antibody. It's called a delayed hypersensitivity reaction. So now this different kind of a hypersensitivity reaction that is happening, in response to that, these wheals might be coming. So what you have to keep in mind is you should not be itching that lesion a lot. The more you start to itch, the more this reaction will tend to increase, and then there might be some serious discharge also coming from those lesions. So you need to identify the cause early as possible, and don't really worry about being contagious. Remembering what the etiology and the cause of the disease is more important over here.
Right. Now that we know that it's not directly contagious, doctor, is it also hereditary? Can it be transferred through genes? Is it possible?
It is possible. There is something called as hereditary angioedema. So it's caused by a deficiency of something called C1 esterase enzyme in our body. So in that case, it's a rare disease. It's not something which is very common, but obviously you have to keep that also into your differential diagnosis. So if that thing is there, you
Mm-hmm.
have to go ahead and test for that enzyme deficiency if it is there in your body. And in case that is the cause, then definitely there is an hereditary component to it. But the incidence that we see of this problem happening is a lot more rare as compared to an acute urticaria, which is the most common kind of an urticaria that we see.
Right. All the people who can relate to this or who has a history of family urticaria, doctor, are there any precautions which they can take on their daily life?
Well, when it comes to precaution, the something that urticaria is related to very strongly is something called a history of atopy. So, what does atopy
Hmm.
mean? Atopy means, in general, a kind of an allergy that is happening into your body. There's a condition called atopic dermatitis that we see in kids that is happening that becomes stabilized once we reach 10 years of age. So, in there also, triggers are something that you have to keep in mind. So basically, whenever there's a change in your outside temperature, you have to be cautious that is that thing leading to any kind of a sensitivity into my skin. Now, what changes am I talking about? Changes in the outside weather. When we are going from a summer season to a winter season, from winter to summers again, that change period that is happening mostly in the autumn and spring time, that is where all these allergens will be suspended into your environment. It will be suspended into your air. Other than that, even something like right now summers are going on, so there's increased intensity of the ultraviolet light from the sunlight. So if you go outside and then you see that there is a change in the ultraviolet light intensity leading to this photosensitivity, as we say in our language, that can cause an photo solar urticaria. So you have to keep that in mind. In general, the tips that you can take in your mind is you should avoid this drastic change in temperature that is happening. So let's say you're coming outside, and then as soon as you come inside, you switch on the air conditioner to the minimum temperature that is possible. So that internal change in the temperature of your body, which was there from outside to inside, has decreased rapidly. That can again lead to this kind of a reaction. Same thing goes in winters. When you come out from outside, you just go directly sit in front of a heater. So this again can cause
Mm.
this. Other than just the change in temperature, something as simple as taking a bath. When you're taking a bath, you should try to avoid very extremely hot and extremely cold kind of a water, and you should try to avoid very long showers. And then if you're the soap, something like even your soaps or body wash, if you feel that is also after taking your bath suddenly there is an increase in your irritation, again you have to keep that also in mind. And in general, moisturizing your skin, specifically after taking a shower, is something which is very essential.
Right. Well, we have talked about something very basic and very important right now. Uh, Most of the people, especially from the place where I belong, it's very humid, and definitely the climate is changing rapidly. People are facing extreme heat, and by AC ka to we are making the best use of air conditioners at this point of time. So, doctor, what do
Yes.
we suggest them? Like, right after they come to their home, we suggest them to settle down for some time and then switch on the ACs. So, how do the process go?
Yes, see, firstly, as soon as you come back home, what you have to do, if we are talking about this weather specifically, you should go inside, start to switch on your fan, start it at a minimum
Hmm,
temperature. Then you increase the regulator, let it go a
hmm,
little bit
hmm.
more. Then you switch on the AC. Again, you don't switch it on at the minimum temperature that is possible. You have to give your body a slight
Right.
amount of time to adjust itself as well. So that will take a
Hmm,
little bit of time. Now, this what we are talking about is just the
right.
air conditioner or the cooling effect that is there. But other than this, the
Hmm, hmm,
initiating
hmm.
cause, like let's say you are there outside in the environment, so the sunlight is there. So you have to, in this weather, make sure that you are applying sunscreen. Sunscreen is very important in general as well, but right now, specifically these 2 months of May and June, the intensity of the ultraviolet light is such that it has crossed the, you can even see it on your phones also, it crosses more than 10 to 12 is the UV index
Right.
that you see. And this in
Hmm,
UV index I'm talking about, it starts as early as 9 o'clock in the morning and it stays up to around
hmm,
4 o'clock. So it means the entire sunlight that you are getting nowadays is above that 10 to 12 range of that ultraviolet light index. So in that
hmm,
kind of
hmm,
a case, to be very honest, even a sunscreen might not be sufficient for you if you have that kind of a sensitive
hmm,
skin. You have to go
hmm,
ahead and then use some kind of a sun protection as well. So when it comes to sun
hmm,
protection, make sure you're taking an umbrella with you, taking a cap with you,
hmm,
and
hmm.
then again reapplying the sunscreen. In this weather, what we tell the patients is apply sunscreen at 8 o'clock, 11 o'clock, and 2 o'clock, because there'll just be 3 hours of protection from your sunlight. But as
Right.
soon as that
Right.
protection level of the sunscreen goes down, this thing will reoccur once again. So again, that is
Right.
something you have to keep in your mind.
Doctor, here we are talking about sun only. But what are the people? What about the people who are working constantly in front of the screen or who are very much exposed to the screen light? They have a possibility of having urticaria as well,
Yes, obviously, the same kind of an ultraviolet light that you see from outside, the same kind of the light
mm,
is also being secreted from any kind of a screen that you're using, your mobile phone, your
right?
computers, your television, from there.
Mm,
And in this case, nowadays, what we are seeing is people do tend to avoid going outside. You have that culture of work from home
right,
now. So
right, right,
that actually sometimes in if you one way of looking at it does make it worse also, because you're in front of your screen, the source of the ultraviolet light is very near to you and you're continuously on your screen. Some people have the job profiles where they're sitting on the same screen in front of it for around 6 to 7 hours at a stretch. So over
right.
here you have to
Mm,
keep in mind that even this might not be something that you will keep in mind, that when you tell people they have to apply sunscreen inside, it takes them a little bit of time to even consider the fact that you
mm,
have to use it inside your
right,
when
right.
house, because we associated the sunscreen with going outside. And specifically when you're talking about the sunscreen that you use inside, the chemical properties of the sunscreen that you're using are very different from the ones that you use outside when you go outside in the sunlight. You need to have that blue light filter into your sunscreen, so the
Mm,
compounds from
mm,
where you're using the sunscreen also differ. So it is a little bit of a tedious work, but you have to go ahead and make sure that the sunscreen that you're using outside and the sunscreen that you're using inside, again they're different, and using that regularly according to that sun protective factor that it is giving you for around 3 hours, and then reapplying it also becomes necessary.
right. Doctor, because we are talking about sunscreen, can you please tell us how to choose our sunscreen?
Well, it depends on what kind of the sunscreen you're using. When it comes to your physical sunscreen, you have to firstly treat about all those chemicals that are there in that. You have to have zinc oxide.
Mm,
So that is something, I'll not go very technically into the chemicals that are there, but when it comes to your physical sunscreens is when it's meant for outside. When you're using an indoor sunscreen, as I said, it needs to have a blue light filter. There's something chemicals or oxybenzone. You have to keep those things in mind. And second thing, when you're using a sunscreen, is knowing which type of sunscreen actually suits your face, because there are a lot of sunscreen nowadays. You see every other company OTC products are there. There are a lot of sunscreen that are available, starting from something as low as 100 to 200 and going something around 2 to
mm,
3000 as well. So it becomes very
right.
confusing using which kind of a sunscreen specific to your kind of a skin type.
Mm,
So
mm,
let's talk about the face types that you usually have. Let's say you have an oily kind of a skin, so then you have to
mm,
use a sunscreen that has a matte finish into it, so that will not make your skin oily. If you have a very dry kind of a skin, then you have to use a hydrating sunscreen. So that is why,
mm,
depending on the type of skin also differs, because sometimes people who have that problem of pimples or acne, when they're using the sunscreen that they use, sometimes they use a comedogenic kind of a sunscreen that is not suitable
mm,
for skin. So then after using that sunscreen, they get even more breakouts and eruptions that are there. So
right.
then using the sunscreen depending on your type becomes very important. And something again that I need to mention is, people usually think that sunscreen is just to be applied on your face, that is not sufficient. In this weather, even applying it on your arms, all those exposed areas of your body, is also something which is very essential.
Right. Doctor, now that we know how to choose our sunscreens, how do we apply it and how much to apply it?
Okay, so broad rule by thumb, which this says that if you take this one finger, you divide it into three parts, and then you apply it according to your face type. But in general, what I personally say is, just take a little bit of sunscreen. Let's say you divide your face into around four parts, okay, and just take
Mm,
like one small drop of a sunscreen, let it go into your skin, see how it feels. You have to make sure that you have to apply a very thin layer of sunscreen. Sometimes this finger and everything, once you start using it, it might be applying a thicker layer of sunscreen that it's required, which will not look cosmetically that elegant also. So always apply a little bit of sunscreen. You have to apply a thin uniform layer which will not have a white cast over it. Sometimes a lot of sunscreen that we see which are available in the market have that white cast. Once you start applying it, you have that whitish kind of a texture onto your face. So again, you have to apply it, and more than applying it, how much, when to apply it becomes very important. So it's not like you just apply it once in a day. People say, always come in like, how many times in a day you're supposed to apply. It's not about how much time that you're applying. When you're applying the sunscreen becomes more important. If you're just applying the sunscreen on your face and you're not doing anything for the next 2 to 3 hours, you're not exposed to any kind of an ultraviolet light, that is also not much of any use. You have to apply before you're going outside in the sunlight, you're applying it. Before you start using a screen time, you're supposed to apply it. So when and how to apply sunscreen is something which is very essential, and the repeat application is also something that the patient has to go into a habit, because it's easier said than done. You can always see you apply it once, twice, or whenever, but making it into a habit is something which is not very easy to maintain. So it might even take a couple of months for the person to actually develop that habit of applying sunscreen properly. So that is something you have
right.
to put the focus more into.
Right, right. Well, that was all about sunscreens that we needed to know. And now, doctor, will quickly move on to the next question. The next question is, can urticaria be caused by stress? And if yes, then how do stress urticaria look like?
See, when it comes to how it looks like, it will look similar. It's basically an acute urticaria, so it'll come under the same time. But yes, stress can cause an urticaria. As I said,
Mm,
when you are stressed, what you do is you start to, and if anything is itching, you tend to become very, very obsessed with itching that part of your body. People sometimes use combs and other devices just to keep itching, because the brain will give you that sort of a relaxation, or that endorphin release will be there. So you feel happy when you itch, and that's kind of
right.
becomes like a habit for a patient that leads to different kind of other allergic problems as well. So basically the
Mm,
thing that will happen is, the person is stressed with whatever might be the stressing or initiating factor. You might be there outside working, by that time it's there in your unconscious mind. Now you come back from
mm,
your work, you change into your clothes, you change into clothes which are much more loose and comfortable, but that stressful factor is still there in your mind. The only difference that has now happened is, it's easier for you to itch all these areas, and then you start to itch the entire skin. areas where you might not even have the lesion, you might start to itch that area as well, which will be more easier accessible to you. Let's say mostly the area around your shins is where you start to itch, and once you start doing that, the brain will give you that relaxation and good kind of a feeling. And then the more you start to itch, the more these lesions can also sometimes spread. So knowing the stressful cause, why it is happening, is something that if you can identify, is the best thing that you can do is stay away from it. And other than that, just have a relaxed, balanced life, exercise regularly, have a good diet. So in general, if your stressful factors are reduced, this problem might not be there. But sometimes the stress factor is not something that is there into your conscious mind. For example, something like a pregnancy, it's not a stress, it's something which is good for your mental state, but your body is treating it like a stress, and sometimes that is the reason that can be happening. So knowing the stressful factor that is there and then avoiding it is definitely something that is the most easier part. The difficult part that is there is trying to avoid that sensation and that feeling of itching, and try to controlling that by either by applying a moisturizer, or if it is not getting controlled even by a moisturizer, you have to go and take the antihistamine drug as well.
Right. Doctor, also tell us, why does urticaria get worse during the night?
During the night. Now, so see, as I said, once you come back from your work, it's easier for you. Let's say you're sleeping. Sometimes even in your unconscious might, even in your sleep, you might start itching. There's something called a chronic itch. Now, that is something that happens mostly for people who are a slightly older age group as compared to us. When you cross your 40s, the hydrating potential of your body also tends to decrease. So when that happens, the skin at the extremities tends to become dry. Now, once it becomes dry, if there's an external allergen that is happening, that will irritate your skin even more, because the moisture barrier of the skin is also decreased. And once you go ahead and start itching it, even in your sleep, you're watching your TV or anything like that, in your unconscious mind, you just start to itch. You might not even know. The other person might be pointing out to you that why are you itching? So that can be something. Second thing that is there is, throughout your entire day you're wearing tight clothing. If you're going to your office, you're having your formal meetings, you're wearing a belt, tight clothing, and all these things called delayed pressure urticaria. So as soon as you come back, you remove your belt, you remove your socks, so all these area there is that accumulation of fluid that has happened, and that again is leading to edema, and again that urticarial rash might be the triggering cause over there. You start to itch that area, and again this problem will increase. So you have to keep in mind why exactly is the cause that is happening, and then go ahead and make sure that you're not consciously itching it throughout the time, because once you start to itch, then the potency of the drug that you're using also has to be increased appropriately. So just try to identify the stressful event. Secondly, once, try from your side to wear loose clothing in general. In this weather, try to wear cotton clothes. So keep these kind of simple things in your mind, and that will go ahead and help you in the long run.
Right. Doctor, are there any dietary precautions or any do's and don'ts for the patients of urticaria?
Well, diet is a very big aspect that we have to talk about in urticaria, because the most initiating factor, as I said before, is diet only. People will be specifically coming after that binge eating from outside or something like that. So, I always tell them that you need to see what exactly was the diet patterns that you were consuming. Sometimes not just for the last 1 or 2 days, sometimes even the last 1 week, what all the things that you were consuming. So if we talk about things that you should absolutely kind of avoid if you are seeing these kind of a rashes coming, is something like, let's say, when it comes to alcohol, wines contain something called sulfites. So usually people will be saying that I don't drink as such, I just have one glass of wine every night and then I sleep, so I'm not an alcoholic or anything like that. But sometimes even that sulfite in that one glass of wine, or if the wine bottle, let's say, was open, kept open, something like that, it was stored, even if it was stored in the right condition, so that can cause a urticaria. Then any kind of a preservative that you're using. So in general, the preservatives that usually are there in your frozen foods, your ready to eat kind of a food, in your jams, your juices, all these things, sometimes if you, even in your cold drinks that you have, all these things contain preservatives, and other than preservative, they contain even coloring agents. So these are the things you have to keep in your mind. Did you consume any one of these things in the last few days? So that can again lead to this kind of a reaction. And then other than this more common causes that are there is any kind of a non-vegetarian food that can cause your dairy product like your milk and eggs, that can cause your, even your basic chicken or mutton, because if you see from outside, if it's not cooked fresh, it can again cause you a reaction.
Mm.
And the most common ones that we see are seafood related. So your prawns and fish, any kind of that, specifically we have it in this weather where the chances of spoiling the food is much more easier. So that can cause this kind of a dietary related issue. When it comes to the precaution or something that you should have, you should ideally focus on having more home cooked food. Then if there are reports that sometimes even gluten free diet is something that is good for urticaria. So as and when you're related to your dietary aspect, firstly identifying why, what was the food patterns that you've been having. Secondly, try to avoid those kind of a thing. If it has happened recurring, I sometimes even tell the patient, you keep a notebook, and whatever triggering factors that you see, keep noting it down, so that next time you come we can discuss regarding that. Sometimes in just one consultation it becomes very difficult to just keep asking about history of everything. What you'll do is you'll go and
Mm.
get an allergy test or some panel done. The report, it might show there's allergy to dust, allergy to this, but that might not be sometimes very, very specific to know what exactly was the cause. Sometimes just asking in detail about the history of the patient by themselves can note it down, and then you can discuss. That I feel is something which will help them in the long run as well.
Right. Doctor, also tell us, can COVID cause hives on the face?
Well, COVID in general is a viral infection. So, and it's a
Mm.
respiratory kind of a viral infection. So, definitely it can cause, not just COVID as such, any simple viral, because now COVID, incidence of COVID definitely has decreased in the last 1 year. We
Right.
are seeing
Right.
cases of COVID. But not just COVID, sometimes even your upper respiratory tract infection, just your, sometimes your nose is blocked, you feel your sinuses are inflamed, and you might just feel like it's fine, I'll get better, you don't take any treatment for it, and you might even get better. But then the next time the virus or whichever bacteria that is there, it gets those good conditions to proliferate once again, it will do so. And then once it does, it might, that issue might be there 2 or 3 weeks before, you might have even completely ignored it from your mind also, but now that the reaction has
Mm.
come back, it is now coming back with the full symptoms. And this time these symptoms might not just be a simple acute urticaria kind of a symptom. It might go into something called as your angioedema, your vasculitis, where I said there might be difficulty in breathing, swelling of lips. So that is why what people usually do is, what I've seen in my personal experiences, that you have some kind of your upper respiratory infection, thoda khansi zukam type ho gaya. And in India anyway,
Mm.
we get all kind of drugs and antibiotics from outside. So they go
Right.
outside, they like augmentin de do, which is something which we know the doctor prescribe karta hai. You go ahead and you take that augmentin. Now that firstly the initiating cause was a respiratory tract infection. The second thing what you did to make it worse is you took that augmentin. Now that is a beta lactam
Mm.
antibiotic. This drug by itself can also cause urticaria. So as you're seeing, this thing will
Mm.
potentiate one after the other. And now suddenly after taking that drug, आपको those symptoms respiratory वाले शायद कम हो ना हो, but these urticarial symptoms is what you will suddenly come up with. And those symptoms will become so acute in nature that before you identify it, you might just start having your swelling of lips, difficulty in breathing. So don't self medicate from your side. As soon as you
Mhm.
get any kind of a respiratory or any kind of a cough, go ahead and get yourself checked up, because it might not be something related to the cough, but skin, as we know, is a representation of what is going on inside your body. So that again can go ahead and cause these urticarial hives or rashes, as we say.
Right. Doctor, for all the patients who are having or facing urticaria on their face, do we suggest them skincare and makeup?
No, not at all. If you're having those urticarial rashes or something, if you go ahead and put any kind of a cosmetic product on top of it, it can
Mm.
definitely increase the reactions that are happening over there. And as I said, your face is supplied by a huge amount of capillaries onto your skin. So as soon as that reaction, if it's there in your body, it might not come as such an acute reaction. But when it comes to your face, and if you apply any kind of a cosmetic cream or something like that, that reaction can just shoot up. So, and that can make your entire face have that red kind of an appearance, uniformly red kind of an appearance. So if you still have to apply makeup, if your job profile is such that, or any event you have to attend that you have to apply makeup, make sure that if you are applying makeup, as soon as that thing gets over, you're taking a mild foam based cleanser and you're cleaning that entire thing off. You should make sure that thing does not remain onto your face for more than a couple of hours, because as soon as it goes inside,
Right.
even in those 1 or 2 hours, it has the potential of causing that reaction. But what happens is people will
Right.
just feel like chalo theek hai, koi issue aaya nahi makeup lagane se, they just sleep with their own the same thing on. So definitely you
Right.
can get these kind of reactions. The things that you have to make sure that you avoid into your face, specifically if you have these urticarial reaction, is any kind of a retinol product that you might be using. Mostly the night creams that you have, they have some kind of a retinol
Mm.
component in that. So make sure you're avoiding that.
Right.
That can definitely increase these symptoms. Other than this, if we talk about your serums also, let's say even your serum, if you've taken a simple OTC serum from outside, they might have
Mm.
added some kind of an additives or preservatives in that. Again, this can react with the already allergic and sensitive skin, and that can lead to urticarial reaction over there as well. So keep your skincare
Mm.
routine when it comes to having this sensitive skin. Know the kind of
Mm.
cleansers that you're using. They have to be absolutely mild. They should not have any kind of additives or any perfume or
Mm.
any other kind of a thing in that. They should not have any, no, it should be ideally be non-fragrant. Other thing apart from your cleansers is your moisturizers. Again, your moisturizer also has to be different. There might be different kind of moisturizers containing aloe vera, something like that, and different extra things also that might be there in there. But you have to make sure the moisturizer is specific for sensitive skin. And the third thing, which is, as I said before, is applying your sunscreen on top of everything, is also something that is quite essential.
Right. Doctor, also tell us what are the treatment options available for urticaria currently?
Well, treatment options, as I said before, firstly, you have to go visit a dermatologist. So, you need to identify the triggering cause. The underlying cause has to be treated. And that's what I usually tell my patients. I might be giving you the drug, you might give you a sedative drug. I might increase the dose of the drug to such that you have to take the tablet 3, 4, 5 times in a day. But until unless the initiating cause is not identified, there is no point of giving that drug, because those symptoms will be stopped till the point the drug is being given. As soon as you stop the drug, those symptoms again will be coming back to you. So again, as I said, when it comes to the treatment aspect, identifying the underlying cause and treating is the utmost priority. Now let's say you have identified the cause. Now what you have to do for the patient, let's say it's an acute
Mm.
urticaria, the first line that we give is an antihistamine. They can be a class 1 kind of an antihistamine, class 2 kind of an antihistamine. So it can be sedating or non-sedating. There are a lot of sedating antihistamines. Usually we try to give non-sedating antihistamine nowadays, so that the patient normal daily function is also not affected. So when it comes to non-sedating antihistamines, your cetirizine, levocetirizine, fexofenadine, these are the ones that we'll be giving to the patient. If you feel the patient is very stressed out, then you can even give them a sedating antihistamine at night. Other than just giving the antihistamine, we in short course we might also give them a tablet of steroid also to decrease the inflammation that is happening. Specifically, if the person is going into some kind of an angioedema, you give the tablet for a few days, a short course of a high dose steroid according to your weight, somewhere around 0.5 milligrams. You make sure the symptoms decrease. Once the symptoms decrease, then you can go ahead and give the patient your normal antihistamine, maintain it with that. But not just your tablets, you even along with that, as I said, you have to give them a moisturizer which is specific for your sensitive skin. Tell them to apply that, keep and apply that as and when it itches. If it doesn't stop, then you sometimes in my few cases can even give a topical steroid to apply on that lesion to make sure it subsides. Other than this, you have to also keep in mind, as I said, the causes that are there. So the cause might be some kind of an outside food that is happening. So that outside food that the person is having can lead to any intestinal worm, so you have to do a deworming treatment for the patient as well. All these things that I'm talking about are more from the acute prospect of it. Now let's say the urticaria is getting chronic, you've given all these things and still the patient has come back to you saying that my lesions were subsided at that point of time, but again as soon as the few months are over, these things have started once again. So when it comes to chronic urticaria, there are few other things that you think about maintaining the patient on. Something called methotrexate. We dose appropriately, start the patient on a weekly dose of it. So that can decrease the symptoms in the long run. There's an anti-IgE antibody called omalizumab. So that is also something that we keep the patient on. These are more technical stuff. Even something called phototherapy is also, we have studies for that also. But these things are more from the chronic aspect point of view. From the simpler aspect, you need to start the person on an antihistamine. If you feel this antihistamine is not being sufficient, you have to updose it. Along with an antihistamine, you also have to start patient on ranitidine also to potentiate the effect of it. And locally, you have to go ahead and apply a sensitive moisturizer to your skin and counsel the patient. Counseling is the utmost importance over here. Telling them the causes, telling them not to keep itching that area. If the symptoms are increasing, go ahead and consult a doctor. You might even have to be hospitalized in case there's difficulty in breathing that is happening. So all these things you have to keep in your mind.
Well, Doctor, I can see the questions coming up from our live viewers right now. The first question comes from Monica Sharma. She asks, are there any specific triggers I should avoid for my urticaria?
Triggers, well, as I said, that the causes that we just discussed right now, I'll just try to formulate it in brief. So, the triggers that are there, as I said, there's a change in temperature. Whenever that change in temperature is happening, that is something which is quite common right now in your summer season when you're going from outside to inside. So, that is one trigger. Change in your weather conditions, these triggers are also there. So, whenever that change is there, that can cause an issue. Then contact related triggers. Whenever you have that urticarial reaction, see what you're doing the last 2 to 3 hours. Try to note that down, whatever things you're doing. Sometimes something even trivial, also note it down so that we can keep that in your mind. Let's say you just went barefoot for a walk into your own garden and you just came back thinking there's nothing wrong that I did. Even the grass that over there might act as a trigger. Then your products that you're using onto your face, the diet that you're consuming, if there's something that you consumed and within the next few hours that reaction did happen, diet is something you have to keep in your mind. The other triggers that are there are exercise induced. You did a workout, after you're sweating, you feel that you came back, took a shower, but that feeling of itch has just not gone, it's just gotten worse. Keep that into your mind. Other than that, there might be something, even let's say you went out for a swim. So as I said, aquagenic urticaria, after that there's chlorine in the water, you come back again, you have that irritation onto your skin. Keep these things in your mind. Contact with any kind of jewelry, clothing, fabric that you use, something, any bed sheet that you changed, after which you feel the irritation has happened. So just keep all those things in mind, and identifying the triggers, as trivial as it is, try to note it down, discuss with a dermatologist. And once you get to know the triggers, you have to go ahead and try to avoid that thing from recurring again and again.
Right, right. Well, the next question, Doctor, comes from Deepak Saxena, who asks, how can I manage urticaria symptoms at home?
At home, specifically, as I said, as soon as that reaction starts to happen, make sure the worst thing that is possible that you can do is you start itching it, because that, I'm telling you, the feeling of relaxation that is coming is sort of addictive for people who have that chronic itch into it in their body. They might not be able to even identify that it is an urticarial rash that is happening, because they have that habit of itching their skin in general. So you have to make sure that the itching, whenever it happens, you are going not itching that area, go ahead and apply a moisturizer over it's there. If you feel the moisturizer is not sufficient, you might even have to apply any kind of a mild topical steroid on top of it. In general, try to wear loose clothings, wear cotton clothes. These are things that you can keep in your mind to prevent the urticaria. But as soon as the urticaria has happened, if you have consulted a dermatologist, then you have to go ahead and take that class 1 antihistamine, whether it's sedating or non-sedating. Usually levocetirizine is something that we have to take, but you have to also keep in mind that it also has that sedating and drowsy potential along with it. So just don't keep popping pills in general. Make sure, if the symptoms are not getting resolved, yes, you go ahead and you take that tablet. Once you take that tablet, definitely the symptoms will go down. But other than that, broadly speaking, when it comes to the prevention aspect or whatever you can do, when it comes these hives do happen, try to keep in mind again the triggers that we are talking about. Did you consume anything like that following which it has happened? Try to make sure that environment in your home is more on the cooler side. and try to avoid extreme of temperature. Sometimes you might be having that rash. Let's say when we're talking about females, you have to go to the kitchen and then you start cooking, and again that heat that is coming from the flame is there, and then again it can lead to that kind of an urticarial reaction to increase. So make sure that you don't itch. Try to keep your body in a normal temperature, wear loose clothings, and then if it still the symptoms are not getting cured even after taking that tablet, definitely consult a dermatologist as soon as possible.
Well, I believe we have to skip a lot of questions today because it's time already. We have fallen short of time today, as there was so much to learn and know from you, Doctor, today. Before we take a leave, Doctor, any take home message for our viewers who has watched us so far?
Well, as I said, urticaria is something which a lot of people ignore in general. You might just have, let's say you went outside, you had seafood, you feel the lips are feeling a little bit swollen, you ignore it off, and then next few days also your skin appears fine. But it's not something that you have to ignore it, because it can come as a chronic rash. Something as simple as I said before also, you don't try to ignore your respiratory infection that happen. If you are suffering from that chronic cough, get yourself evaluated. If you suffer from that chronic itch which is not going, and there is that feeling of irritation that happens whenever you come from outside, whenever you're having a workout, or even after consuming something, some certain kind of foods, don't try to ignore these symptoms, because urticaria is something which is a very simple disease to manage. What is not simple to manage is the supplementing disease progression that happens over there. Which I mean by that is your angioedema, your anaphylactic shock. These are life threatening fatal conditions that can happen. So all these things, if you are developing like that, you're having difficulty in breathing, do not go ahead and think that okay, I'll just take a tablet and it will get okay. It might be a very serious disorder that you're ignoring right now. So you have to go ahead and then consult your doctor as soon as possible. And other than that, as I said before, try to maintain a healthy lifestyle. Try to wear loose cotton clothes in this weather. When you're going outside for working out, try to make sure that you apply some kind of a antiperspirant powder also, so that the sweating doesn't increase. And then make sure the changes in temperature that are there in general, also even on a day to day basis, try to make sure they're not very very drastic in nature. Try to avoid these very hot showers that people have. Very cold showers also by sometimes can also irritate the skin. So in general, try to maintain a balanced and other than that, most important is your balanced diet. You have to make sure that the food that you're eating has that nutritious component. Consume fresh fruits. Try to avoid this outside food, because you never know which kind of the additive substances or preservatives they're adding. It will become very difficult to even identify people who are having these outside food every other day in their lives. So it becomes very difficult to identify what exactly did you have also. So try to consume a basic diet. Try to, if you can go in for a gluten free diet, that will be great. But other than that, just having your normal products, and even in your normal daily routine, the diet, if something does cause that irritation or these appearance of that hives, don't ignore it. Keep a diary or keep noting down all those triggers that were caused before, and don't feel shy. Go ahead and discuss all those things with your dermatologist. Sometimes something very trivial or something small might be that factor, and which once you ignore or once you treat that cause, you don't need to go in for all these tablets, antihistamine, steroids, or anything like that.
Right, absolutely. Well, that was Dr. Jatin Sidhwa for us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers, and I'm sure they will use this information to prevent themselves and their near and dear ones from getting urticaria. In case they get to see such symptoms, they know now what to do instead of self-medication. It's better to approach a nearby dermatologist. It was great to hear from you, and we look forward to many more such sessions in coming time with all our viewers, because we have missed a lot of questions. So we have to attend it next time, Doctor. Thank you so much, viewers, for your participation today for your session for this session. To get latest update on how to keep your skin healthy, do like, follow our FB page all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.